Alright, hello everybody. I'm going to go over doing a vaginal exam. So first things first, always want to glove up. Doesn't necessarily need to be with sterile gloves, but just nitrile-free examination gloves are appropriate. I like to use some kind of lubricant. My preceptor will use aloe vera gel, like an organic aloe. I think just like coconut oil or something that, is a little just neutral, or even just a sterile lubricant, like water-based lubricant if people have just specific skin conditions or allergies or anything like that. So we always want to make our clients feel comfortable. In our clinic setting, it's just a one-room clinic, so we'll step out to let the client change. We don't really offer like putting a drape or anything over. Maybe we could do that, but the bed is really warm. There's a nice blanket. There's always, essential oils, and it smells good. We try to make the environment really nice when we have to do a vaginal exam in the clinic setting, and in the home birth setting as well. So the client's going to be on their back. Typically, my midwife preceptor will just have them bend their knees and then let the legs fall out gently. And then I always insert 2 fingers. I like to tuck my thumb in. I know some people think it can be sensitive with like the clitoral area, but I feel like I can't get in far enough if my thumb is out like that. So I just tuck it in. So I always, let the client know that we're about to begin. I ask them if it's okay. I never just stick my hands in. I like to gently touch the side of the leg, usually with my right hand, and so you're going to feel my touch, and then I'll spread the labia with my left hand just so I can kind of see what I'm doing, and then I'll insert my 2 fingers, and trying to palpate around and see what I'm feeling. I'll then remove my left hand once I'm in, and yeah, basically just feeling for if it's in labor, we're definitely trying to go through the cervix to feel the baby's head, and if we can't feel the baby's head, we're trying to assess suture lines and fontanelles and see the baby's position, as well as dilation, station, according to the ischial spines, and effacement as well, just to see how thin the cervix is, and then gently remove your hands and take your gloves off, and then report your findings. I'm always extra cognizant of making sure that the client feels really comfortable throughout the procedure. So once I'm in, I ask, like, are you doing okay? If you're not at any time, if you feel uncomfortable, if there's any emotions, let me know, we can stop. I usually will tell the client that before, but then always checking in as my hand is in there, making sure that they're okay, especially if it's going to take a little bit of time in the beginning to kind of really assess what you're feeling. I think it's important to just kind of relay and make sure that the client is still at a level of comfort, general comfort, to where there's no indication to stop the exam. So yeah, that's how I do a vaginal exam, and I look forward to hearing how you guys do it.